Hello, everyone. My name is Dr. Richard Horowitz, and I am the co-host of the Doctor's Talk Healing Lyme Summit 2.0. And it is my great pleasure to introduce to you today Dr. Jill Christa. Jill is a mold expert, and today we are going to be discussing the role of mycotoxins in chronic illness, like chronic Lyme. And Jill, I just saw you at iLads. It was great to see you there, and
Nice.
thank you for coming on today for Doctor's Talk. Why don't you introduce yourself to people? Tell them a little bit about who you are and how you got into all of this.
You bet. So I'm a naturopathic doctor, so I came to this through the naturopathic route. I also live in Wisconsin, which is one of the leading areas of Lyme disease incidence, especially Babesia with co-infections. So I started in the Lyme world, and I had these patients that, when natural medicine didn't work, I went and got iLads trained to get more comfortable with using antibiotics. And so I did the integrative model, and people just got better. When you identify and treat the cause, it's amazing what happens. But then I had this subset of patients that weren't responding. And in one of those patients, they found toxic black mold in a remodel. And there's where the Pandora's box opened for me, because I thought, I wonder if this is why he gets terrible ear ringing from the antibiotics. He has terrible anxiety that goes the opposite way from anti-anxiety medication. So counterintuitive reactions to medications, gut's a mess, chronic pelvic pain, all these just goofy symptoms. And I was like, I wonder if this is what's going on. Because in naturopathic school, we learned about environmental medicine, but I learned about mold primarily as an allergy problem, not as a toxin problem. And in rare cases, toxic black mold can cause MS-like symptoms. That's basically what I left school with. And when I hit the book, I hit PubMed, and I was like, oh my goodness, I'm missing mold all over the place. And I'm not seeing that in human studies, I'm seeing that in animal studies, because we know a lot of these mycotoxins are carcinogenic. They're listed as carcinogens by the WHO, by the cancer societies. So we can't create a study where we're going to poison someone with mycotoxins to figure out how to get them better. So a lot of this knowledge is just by looking at animal research. And I did that deep dive, and I realized, wow, a lot of my chronic Lyme patients, a lot of my MS patients, a lot of these, chronic fatigue syndrome patients, they actually have mold. And when we addressed that, then we saw the needle move. So that's how I got into this mold expert thing. Started in the Lyme world and then expanded the reach.
No, of course, it was, of course, the same for me. And, I don't know if you know, I used to joke with Neil over the years because when we started also, I know you do a training course with Neil, and I've, of course, incorporated him into my training. And years ago, when we started doing the training, I used to joke like, look, it's mostly for me the three Bs. It's Borrelia, Babesia, Bartonella. I'm seeking leaky gut, and I'm seeing mast cell activation and microbiome issues, sleep disorders, vitamin mineral deficiencies as these major, things driving inflammation. And it's not that I didn't know about mold. I would find it. I just didn't actually think it was playing as big a role as it did.
Same.
And then
Yep.
it was kind of like over the last couple of years, and I don't know what has changed unless it's people are getting sicker from all the viruses. And I actually think long COVID may have precipitated this in some of the patients because I was having a really, really good success rate years ago with the Dapsone protocol. And then all of a sudden, there'd be a group just like you were finding that weren't responding. And it was like, okay, let's go looking for the causes. By the way, the root cause thing, which you guys learn in naturopathic school, I
Yeah.
am so shocked because I realized, and I thought maybe it's because I did my medical school in Belgium for 7 years, where, they
Oh.
teach you, I think, differently because I always from day one was starting to look for root causes of things, not just name a disease, throw a drug at it. And same thing with us. We learned aspergillosis, right? Allergic asthma, same exact thing. If you got some allergy symptoms in your sinuses with mold, but not carcinogenic issues, not immune suppression, not chronic fatiguing overlaps with these things. So you're right. I had the same kind of come to God with this after a while, like, wow, mold's really playing, a big role in these patients. And now, of course, we're finding it in, I mean, I would guess 80 to 90% probably of all of our patients at this point.
Your chronic Lyme.
Absolutely. And
Yep.
it's gotten worse. And in fact, the last couple of years, and I've kind of wondered whether the climate and the hurricanes and, the buildings, being affected now from flooding, I've wondered if that's why I'm starting to see so much more of it. Of course, I'm testing now, pretty
Mhm.
much everybody, whereas
Yeah.
years ago, it was not like one of the first panel of tests I was doing. Now people walk out of my office, it's like, here's your adrenal test, here's your mole test,
Yes.
right? It,
Yeah.
yeah. So tell me a little bit. You started discussing a little bit about these chronic fatiguing illnesses, like the overlaps you were seeing. What are you
Mhm.
seeing as far as like the symptoms that you're seeing? And can you really tease it out at this point? Because, Joe Brewer's article years ago was on chronic fatigue and mold, but it wasn't really discussing like neuropathy, right? How much
Right.
neuropathy is due to mold, right? Or how much
Yeah.
cognitive dysfunction. Can you talk a little bit about the overlap you're seeing in the symptoms?
Yeah, well, if there is a Venn diagram though of chronic Lyme and mold, it's almost exactly the same. We see a little more of the allergy component and less of the infection component with mold, but there's a lot of crossover. And I want to thank you actually for your MSIDS questionnaire because I took that into my own clinical practice and used that model to create a questionnaire for mold. And I followed you to the bathroom one time at a Lyme conference that I was saying, what if we could create something like this for mold? And you were like, well, it's going to be pretty much the same symptoms. So that was a challenge for me of like, in my impatience as a practitioner to find the cause, I really sat with that. Like, what is the thing of my people who have mold and only that? They're not Lyme and mold people. What are the things that are distinguishing and different? And so I created a questionnaire using your model, which is, Burrascano model using these three categories, weighting them differently. And that's actually the subject of a mold study right now that Neil and I got funding for. It's an IRB approved study that we are validating our questionnaire like you did and with your guidance. So I'm just telling it, but I'm just telling everyone who's listening that this is happening. So if anyone's listening, if you would participate in our data collection, it's crowdsourced information that's at moldiq.org. Patients can go there, fill out their symptoms, and then submit their lab results. And we're going to data crunch that and be able to answer your question with such precision that we can't do right now. So right now there are kind of symptom clusters, fatigue being number one. So that can look like an athlete who has a lower VO2 max, or that can look like somebody who can't get off the couch.
Mhm.
So it just depends on what level of health you started from and how severe is your exposure to mold and mycotoxins. So if you're getting a huge exposure to the mycotoxins, we know that they cause mitochondrial deficiency. They change the ability to make energy in the body. So fatigue is going to be kind of the across the board symptom that we see. Now, that's not really specific to just mold or Lyme so that doesn't tell us a lot, but it's really important that it's part of the picture. Anxiousness is another one. The way that we see that mold spores will stimulate mast cells, you were talking about mast cell activation, and then the toxins for mold, whether it's living mold or mycotoxins, those are going to change the alarm systems in the brain. So it actually affects the limbic system, which is our survival center of our brain, and it will raise the fear perception in the limbic system. So we see anxiousness quite a bit, and that can just feel like general unsettled, something's not right. And people might start to, try to pin something they can put their finger on because mycotoxins have no odor. So if the mold is not exposed to the air, you're not going to get that musty smell. It has to be exposed to the air to get the other things, the aldehydes and things that actually smell like a musty smell. But mycotoxins have no odor and they're a nanoparticle size. So they can be polluting the indoor environment and there's no warning sign. And so the limbic system is saying, we're not safe, we're not safe, we're not safe. But the eyes don't see something, the ears aren't hearing anything, the nose doesn't smell anything, it's not tasting anything. So it's like it starts to create this split in the limbic system. So I would say
Mm.
fatigue and anxiousness are the most common across the board. And when I'm saying anxiousness, think of it as like a general feeling of unrest, something's not quite right, but you can't quite put your finger on it. And so you might start pinning it. Oh, it's my marriage. Oh, it's my kids' behavior. So they start pinning it on other things, but it can be these mycotoxins causing the problem.
Right.
Visual changes are very, very common. I'm sure you see this a lot.
Sure.
Frequently changing vision. You go get your glasses done, and then 2 weeks later, they're not working for you, and you think your eye doctor is not good at their job. It's because mold is causing our visual changes. Ear ringing, I was talking about, sinusitis can happen. Lung sensitivity. So you have lungs that you can't be near a smoker at all, or your lungs are going to react, or you might react to dust more so than somebody else, or wildfire smoke is really hard on you. A lot of gut changes, urinary sensitivity, frequency, and then just generalized skin rashes. That's kind of the cluster that's the most common. But
Mhm.
what we're trying to do with our study is then, if you see this mycotoxin, what is the symptom cluster that goes with that? Yeah.
Now, question: when you're doing this, of course, the problem is that the overlaps with fatigue, anxiety, right? All of this,
Yeah.
and including cognition, because it is affecting cognitive functioning also, right? The
Right.
problem, of course, is Lyme does this. It causes anxiety, brain fog, and fatigue. Bartonella does it, right?
For sure.
We're seeing it in long COVID, which now, I started using Radiance Diagnostics, Bruce Patterson's lab, and we're getting his 14 chemokine cytokine panel. And we're seeing a lot of people that, when the CCL5 Rantes, is positive and there's a IL-4 and VGF, the long hauler score is high, but we're definitely seeing a lot of people at this point with all these overlaps. And
Mm.
so it gets tough because BART does it, Lyme does it, long COVID does it, mold does it. And of course, half of my patients, at least, I affectionately called the walking wounded, right? They've all had trauma, myself
Mhm.
included. I've had,
Yes.
physical trauma when I was young and emotional trauma. And I think as a physician, I probably have a bit more compassion for people who come with this because, my
We
wife and I
lived it.
are empaths and we feel into people and we get it, right? We get it. I feel sorry for the people because I understand what they've gone through. But the limbic system gets affected by all of these different things. And then the problem with the cell danger response with the mitochondria, right? After I do Dapsone, we put them on a mitochondrial regeneration protocol. But it's true, if you're not in a safe environment, if the mold is still there, or you're otherwise, it's like it's not going to do its job. The mitochondria are not going to get unstuck from the cell danger response, and the energy systems are not going to, come up. So it's kind
Mhm.
of complex. It's like when I used to joke with people, someone comes into my office with the MSIDS, model with 16 nails in their foot, and the doctor, finds one nail, pulls it out and says, "Come back in a month and tell me how your foot pain is." And it's like in our world these days, it's Borrelia, it's Babesia, it's Bartonella, it's mold, and it's long COVID right at the top of the list,
Right.
followed by mast cell disorder, which is stimulated by Lyme and Bart and mold and long COVID, right? So we're seeing
Mhm.
that with leaky gut and food sensitivities, vitamin mineral deficiencies. I can't sleep. I can't fall asleep. I keep waking up. And then the 10 downstream effects of the inflammation of it affects the HPA axis where inflammation throws off your hormones and the men come in with low testosterone and the women's sex hormones aren't working and the adrenals are low and mitochondrial dysfunction, POTS dysautonomia, right? It's also showing up and that causes fatigue and anxiety. So,
Yeah.
so it's kind of like chicken and egg, right?
Totally.
Yeah, with all of these things that are happening. So
Mhm.
you've not yet been able to tell what's specific. And by the way, when people fill out your mold IQ, and again, it's moldiq.com,
.org.
.org,
Yeah.
moldiq.org. When they fill this out,
Mhm.
have you asked them to send at the same time their
Yes.
Lyme testing, Bartonella testing, long COVID
Oh,
testing?
no. We should expand our IRB. That's a great idea.
Please do it
Yeah.
because we are finding such overlaps in this community at this point, including when you do the radiance diagnostic with VGF. Long
Mhm.
COVID can cause inflammation in the vasculature with endothelial dysfunction and cause the VGF to go up, but so does Bartonella. So I said to Bruce, well, is it COVID? Is it a Bartonella or is it COVID and Bartonella, that's doing it? And then again, so it's just the overlaps I think would be interesting because you may find the people that say my anxiety is severe is
Mhm.
the
Have
BART,
BART.
the BART is overlapping the mold. And
I
the
can
ones that
tell you in
say,
practice, that is the case.
and
That is absolutely the case. Pandas, pans, anxiety, irritability, rage. It's not just mold. BART is in
right,
there. Hmm. Yeah.
right.
Yeah.
So you'll probably find the extremes of the severe cases,
Yeah.
right? Will be in that case. But again, so for those of you who are listening, what Jill and I are discussing with the symptoms of mold toxicity, you're saying it's overlapping pretty much every tick-borne symptom, brain fog, even neuropathy, right?
Yep. A
Which
lot of neuropathy, a lot of neuropathy. I remember learning about Lyme and thinking, this is a neurological disorder. This isn't just a joint thing. This is a neurological disorder. And then getting into mold and mycotoxins and realizing mycotoxins are neurotoxic. This is why there's so much overlap. I mean, it is really, yeah, that
and
would be
and
really
what
fun.
And one thing, since you were talking about using my questionnaire, the which I
Mhm.
abbreviated as HMQ, the Horowitz-Emsids questionnaire, which people can find on my website, www.cangetbetter.com, and Jill's moldiq.org. What I would ask about the neuropathy, if you're using my questionnaire, is it migratory? Because the
Mhm.
one thing we found with Lyme is now at the time when I did this, we didn't know how many patients really had BART because we didn't have BART fish testing when I
Right.
started validating this questionnaire back in 2017. It is possible, of course, Lyme, as far as I know, is the only one that causes migratory joint pain, migratory muscle pain, but specifically migratory nerve pain. What would be
Mhm.
interesting, and this is a study, I got enough on my IRBs right now. I'm looking to do a randomized trial on dapsone. But if you ask the people with mold if they have neuropathy, is it migratory or not? And they tell you, no, it's not. And they have not been lower. They're negative testing for Lyme and Bart. It's like, okay, you can then differentiate to a certain extent where
Mhm.
Lyme question mark Bart is causing the migratory neuropathy. And if it's not migratory, mold may actually be the primary factor. But again, the problem is, and I'm not going to tell you to keep adding things to your IRB because you'll go crazy. But when we check heavy metals in the blood,
Oh,
like
yeah.
mercury, arsenic, lead, they all cause neuropathy, as does, of course, diabetes with metabolic syndrome and hypothyroidism and, carpal
Gluten
tunnel.
sensitivity. Yeah.
Right.
Yeah, I can tell you
Autoimmune.
from practice. So this questionnaire I've been tweaking over 15 years, so this is that's how I even got to the quantification part of it, was to see, am I catching mold when it's there? Am I over reporting mold when it's not? So there's a score that they get at the end, which is no, not probably mold, possibly mold, or probable mold. And then I
Right.
always recommend that they fill out your questionnaire to make sure, is it Lyme, and is it MSIDS, because it may be that and not the mold. And so that's where we, the teasing out. But I can tell you, I ask about migratory all the time because I started in the Lyme world. Mold neuropathy does not migrate. It doesn't. So
I,
it,
I, I would have been surprised if it did.
yes, yes,
Because even Alan Steer, back early on in Lyme, if you read his early work on acute Lyme,
mhm,
migratory pain was showing up in those Lyme. Right.
yeah,
So I'm
yeah.
glad to hear that you're not thinking that that's the case.
Yeah. And surprisingly, the ice pick pain that we all say that's a mold thing, that's coming up as more of a BART thing, and not the strictly mold sensitive patients that don't
Mhm.
have Lyme or co-infections. They don't have the ice pick pain. So I think that's a
Just
BART. I think that's unique to BART.
just like when Joe Boroscano years ago identified pain in the bottom of the feet as being one of the classic BART symptoms. That
Yes.
has held true over the years,
Yeah.
right? Interesting
Yeah.
finding.
Yeah.
And just yesterday, I had a whole family fly out from California, by the way. And this young woman came to see me because she's got very severe neuropsychiatric illness, right? And when I examined her, there were the Bartonella purplish stretch marks perpendicular to the skin planes. And the psychiatrist treating her, who had her on Prozac and Abilify, had no idea this woman had Bartonella.
Yeah.
So she went
Or
home
they're
with
never
a
going
mold.
to fix it.
No, so she went home with a mold kit, right, on top of the adrenals now, right? So, and
Yeah.
by the way, regarding the Lyme, I think what's also interesting for people listening to figure it out, just know when you get back your Western blot or preferably your immunoblot, which is checking 8 different strains of Lyme, you want to play Lyme bingo, my favorite game of what numbers show up on the Western blot or immunoblot, which is the 23 OSP-C, 31 OSP-A, 34 OSP-B, 39 83/93 are very specific for Lyme on an immunoblot. The 31 overlaps with Epstein-Barr and autoimmunity on a standard Western blot. But just know when you're filling out Jill's questionnaire, moldiq.org, and if you're uploading it, if your doctor told you you didn't have Lyme and you have the Western blot or you have the immunoblot, I'm even going to tell you to send to Jill, send the bands, let her
Yeah.
know because ultimately this is important stuff to corroborate in this test, right? To be able to figure out
Yeah.
whether there may be an overlap or not.
Yeah.
Yeah.
Yeah, it's so interesting too, because the people that I think this is kind of, we know mold is the problem because they know about their building. And as we start to get them better for mold, the Lyme symptoms get much louder. And I always explain to them that's because the mycotoxins are causing immune deficiency. It impacts the immune system in three really key ways. It's toxic to the actual immune cells out there in your bloodstream and in the periphery, causes epigenetic changes. So for people listening, that means the cellular soup that our DNA is swimming in, mycotoxins are impacting the expression of the genes so that it expresses more inflammatory state than anti-inflammatory. And then it's genotoxic. A lot of these mycotoxins will actually go in and rewrite the immune genes to be more susceptible to fungal invasion. So invasion from foreign invaders, which includes other infections.
Of
you know?
course.
So when we think about that, it's like, well, it makes sense as we get this thing that's reducing your immune depletion out of the way that the body shows us stronger vitality often means worsening symptoms, but clearer. So it's not this like amorphous, okay, this person has so many symptoms, we're not sure what is going on. When we can get the mold out of the body and all of a sudden the soles of their feet and the ice pick pain gets really severe and they're starting to be really anxious, I'm like, now we know the next target. That just got way clear. And that told me we're going in the right direction. We strengthen your immune system enough to get loud. And we
And
want
what's really important about what you just brought up is when I published the study last year in Microorganisms 2023 about Lyme and Bartonella and comparing the 6-day high dose dapsone pulse to 4, what we found with BART is BART caused the same types of immune deficiency we were seeing with Lyme, where you see low immunoglobulins, low subclasses, and the people who had the most strains of Bartonella and or Babesia overlapping had the worst immune deficiency, the worst neuropathy, the worst autonomic neuropathy with POTS, dysautonomia, and the worst neuropsychiatric symptoms. So what people need to know here is, since Lyme is an epidemic proportion and it causes chronic variable immune deficiency or subclass deficiencies, and so does BART, now you're hearing also, so does mold with gliotoxins arrest. And the next one to add to the list, because the Lyme and BART are affecting your B cells that make antibodies, is when you get long COVID, it's now affecting your T cells. So now you're getting T cell exhaustion, right? Where you can find viruses in cancer. And here you've got mycotoxins, carcinogenic, lowering your immune system on top of BART that's been associated with cancers, right?
Yeah.
With
Oh,
melanoma.
interesting.
Oh,
Melanoma.
melanoma and inflammatory breast cancer is now associated in the medical literature with Bartonella.
Whoa.
Yes. So we're talking this trifecta of Lyme and Bartonella and mold and even the fourth long COVID.
Now,
All
yeah.
of, for people out there that are worried about the viruses that are spreading, bird flu, monkeypox, trickle E, West Nile, dengue fever, all these viruses that are spreading with the climate at this point, you need to get your immune system checked with immunoglobulins and subclasses, natural killer cells and T cells, CD4, CD8, right? And basically check for these toxins because we're getting exposed to all these infections and toxins affecting our immunity. So I would guess that a lot of the people with long COVID who get the worst symptoms, they're showing this, they have Lyme and Bartonella. And they're going to
Yeah.
end up having mold on top of it. It's going to be the same toxic soup that you and I are talking about today that's going to end up being some of the answers for long COVID. And when I published the article this year in Microorganisms in April, we found all 16 factors on the MSIDS model were with long COVID, just like it was with Lyme. Every one of them. Differences, one is a virus, one is a bacteria, but
Yep.
the inflammation, I mean, there's different inflammatory cytokines, the way it presents, but it's basically the same 16 factors. Just the microclots are a little worse, obviously, with COVID because of what happens with the spike proteins.
Right.
But yeah, I mean, it's important for people to know, listening to us, please check your immune system, right? Because we're all being exposed, and I don't think a lot of people realize how dangerous this is.
Yes. And to give a moment of hope, by knowing that, by measuring it, and there's also one that I measure for long COVID, that's the NLR, neutrophil to lymphocyte ratio. There is data in COVID, the higher that number is, the higher risk you are for having worse outcomes. There are some great, easy things you can do. The things that I'm seeing move the needle the most for that viral Lyme, immune thing is vitamin A. A lot of people are deficient in vitamin A, so have your doctor check your vitamin A. There are herbs that you can take every day that you can get from Frontier Herbs. You can get very cheap, like a whole pound of powdered astragalus, also larch or larix, and also aloe, the long chain polysaccharide aloe, not just aloe juice for soothing your gut, but the long chain polysaccharides. So you want to check your aloe supplement and make sure it's a long chain. There's a certain like 140,000 Daltons, that we want to hit. So if anyone wants to know the size of the chain, just email me and we can get you that data. Those three things have been profound for raising people's immunity. We're seeing subclasses improve. We're seeing, the NLR improve and also immunoglobulins orally.
So again, just repeat this. You're talking
Yeah,
vitamin A, large like large
arabinogalactone. Yep.
raminoglycans,
Yep.
and
Mm-hmm.
also aloe, but the long chains.
Aloe with a long chain and astragalus.
And astragalus. So those are the
Yep.
ones you're finding have the biggest effects.
That trio, and not every, I treat a lot of kids, and not every kid really likes to take everything, but those are all really easy to get in a kid as well. So if you're dealing with kids, they all taste pretty good. Larch and aloe. The aloe is a little more on the bitter side, but if they mix those three, put it in a little syrup or whatever, and you can get it in a kid too. But those are the things I'm seeing really move the needle. The astragalus dose needs to be about 600 milligrams twice a day. The larch, around 300 to 500 twice a day. And then the aloe, we're looking at, it depends on the long chain, but we're looking at about 500 milligrams a day is helping. And
Got it.
then vitamin A, I just have, because it's fat soluble, you don't have to take it every day. The body can absorb it. However,
Right.
if someone is mold sick, their bile is real gummed up. So that whole fat soluble nutrient absorption thing is interrupted. And if they're on binders that are bile sequestrants, they're not going to get that A in. So the A needs to be in an emulsified form. One of the doctor brands I use is Soroil. They have something called Emulsion. And I just do a big dose every week so that you don't have to think about it every day. So anywhere in the 200 to 250,000 I use per day, per week. I say
Mhm.
this right. And then measure vitamin A if you're taking vitamin A because it can be toxic to the liver. So make sure your doctor's monitoring your level. But yeah, so those three herbs, vitamin A and oral immunoglobulins, like something like an SBI Protect, they have been helpful at improving the NLR, so neutrocyte to lymphocyte ratio or neutrophil to lymphocyte ratio, and bring up natural killer cell count.
The other thing that we have found extremely useful is I published the first article in the world literature on glutathione for COVID back in April 2020. And at the time, I decided to give it because we used to give glutathione IV when a Babesia patient would come in with shortness of breath, and we'd find within minutes the shortness of breath would clear. By the way, we also found with the visual stuff you were discussing earlier, right? Doc, I've got this blurry vision here. Take 2,000 of glut orally a day for 7 days. Get back to me. And half the patients say, oh my God, my vision cleared. And it's like, oh God, you got neurotoxins. Go check yourself,
Yeah,
right?
yeah.
I,
You're
I
like,
mean, we
dang
saw it for
it.
years. But what we didn't know at the time is the viruses have to lower glutathione to replicate. And I didn't know this at the time because I've been using glutathione for decades, for detoxification and pulling out fat soluble toxins. What I didn't realize is whether you're talking about the flu or HIV or dengue fever or COVID, they all have to lower glutathione to replicate. We have not had one death in our entire medical practice in 4 years with COVID. But on my website, cangetbetter.com, I have the protocol back from 2020. It has not literally changed, right? We had melatonin from the very beginning as an NLRP3 inflammasome inhibitor. We had vitamin D, which it showed that people with the highest vitamin D levels did better. We were using glucans. I use immunotics from Zymogen, 500 to 1,000 a day. We were stimulating NRF2 with curcumin and broccoli seed extract, basically using Oncoplex from Zymogen, but there's so many good brands out there of glucoraphanin. We found that stimulating NRF2 to lower inflammation, blocking NF-kappa B with NEC, alpha lipoic acid glut, these people did incredibly well. And this is, of course, before Paxlovid was available. So these are
Because we
great.
had to do something.
Yeah.
We had to do something.
No,
Yeah.
absolutely. So these are great tricks we're sharing for immunity. And I just took notes, by the way, just to make sure I was down. By the way, that's the beauty of doing these doctor talks is we're learning from one another, right? As we do all the time when we're doing this.
Yeah, like the melanoma bark connection. I had I just, two patients just popped in my head that I need to go check now.
What
So
about
thank you for
testing?
sharing
Tell us a little bit about testing. Differences between antibody testing, Great Plains Mosaic versus or Vibrant versus doing the real-time lab urine testing. I know Neil's biases on this. Let me hear your take on it and what
that.
you like about the testing for mold.
Oh, testing. So I think I've done more split sample testing than anybody on the planet. I'm pretty sure. I don't know of anyone else that's done it. And I also have identical twins, and my friend has identical twins. So I got to kind of do some, twin research, which, my kids kind of jokingly call me Hitler when I start saying, okay, you take this and you don't. And then I need your pee. But so the dark joke. But yeah, I mean, I had also patients where I was sure something was happening and it wasn't being represented in the lab. And so I thought, I want to understand how these are the same and how they're different a little bit better. So I have years and years of using real-time lab with the same urine sample as a mosaic, and then Vibrant came along. And so I added Vibrant, and then my Myco came along and added my Myco against building. And now I just want to warn everybody, trying to match your mycotoxin testing to your building is crazy making, because you can be sick from a mold exposure 10 years prior that colonized your sinuses, colonized your gut. You are now the moldy building, and it was that next building that tipped your cup over. So you may not be able to match it to your building. So I just want to say that, because that makes a lot of people really freaked out. They're like, they didn't even find that mold in my house. Oh no. And it can be really anxiety provoking. So I just want to say that. So in my learning, I found that if we use glutathione with the mass spec urine method, we're actually underreporting many of the many mycotoxins, because the glutathione is changing the molecular structure, and that mass spec camera is set to look at one molecular structure. But when you add glutathione, it's a few steps down the metabolic pathway, and the camera is missing it. And I learned that from my twins. One was really good at taking his glutathione, one was not, because he didn't like the flavor. I didn't even know I was doing a split sample, because identical twins, same genetics, same house, same exposure, same diet. I was cooking everything. They went to the same school, so lunches were the same, school exposure was the same. The one that took glutathione, his trichothecenes were a lot lower and some non-existent than the one that did not take the glutathione. And I thought that was really interesting. So then I just repeated it to see if that was something that happens, and it was repeatable. So now I try to make sure there are a lot of things I learned. I learned about how diet can impact urine mycotoxin testing. And I think the big question that I get is, what's your favorite test? And I always say that's not the right question. I want to ask a question back, which is, what's the question you're trying to answer? Because that's going to require a different cluster. And I do think in a perfect world, we would run the antibody blood test against mycotoxins,
Mhm.
also antibodies against mold, because if someone's allergic to mold, that's a little warning sign for me that they have mold in their environment. We should be able to handle a little bit of mold outside, and we all have to, live in, I know where you live, same thing. Like, this is the time of year where all the leaves are on the ground, they're getting wet. There's more mold in the environment. So we should all be able to handle that and not have a fulminant allergic reaction. And I think it's really important to run a urine mycotoxin test, because then we're seeing what's the body burden. And so if we're trying to answer the question, the most important question to answer is my patient exposed to mold right now? The best way to do that is a mold allergy test to regular old spores, a MyMyco lab mycotoxin antibody test, because that will tell us if the IgE is high, there's a very high chance that person is exposed currently in mold. So in the last 2 to 4 weeks, in an appreciable way, an extent to have their antibodies being made. People with that HLA pattern aren't as quick to make the antibodies, so that they'll be underreported. And people taking suppressive medication, like if they're on steroids or something like that, that's not a great lab. So that's a nice thing about having so many options, because we can pick and choose what works for our patient. But then running a urine mycotoxin test, the ELISA and the mass spec are measuring different things. So that's another thing that people will say, I ran my own split sample test and I got a different ELISA result than I did from the Mosaic or the Vibrant. And I would say, yeah, of course you would, because they're testing different methods. Any positive is significant. So this idea that, we're going to throw out a lab because it was different than the other method, it doesn't make any sense to me, because they're measuring different methods. So if a patient must be on glutathione because of their brain fog or something that I use real time, and I don't use the mass spec because I learned it's going to falsely lower the trichothecenes and other types of mycotoxins.
Mhm.
So I could go on and on about like how to test, but to answer the question about, is my patient in mold allergy, my mycotoxin antibody, if the MPA is high on a urine test, the MPA is a mold metabolite. It's not a mycotoxin.
You're talking mycophenolic acid.
Mycophenolic acid. Yep. So mold will make that if it's actively growing. And it's water soluble, so we clear it pretty quickly. It's rapidly absorbed and it's rapidly excreted. So if we're seeing a high IgE on the MyMyco and a high MPA on the urine, that person's probably in mold. And that's our first priority, is getting the mold taken care of.
Yeah, so I'm mostly, and again, I learned this from Neil years ago. I'm mostly using the real-time lab, and I do use glutathione an hour before, but almost everyone has trichothecenes now when I'm testing them. I mean,
Yeah,
I
because the ELISA shows it.
yeah, I mean, I'm
Yeah.
basically seeing it almost in everybody. The aflatoxins are generally high. The highest I've seen, by the way, was 50 times above the normal range in a patient in Europe who did not respond to 7 pulses of high-dose dapsone, active BART, BART-FISH positive, would get a little help. And I kept saying to him, "Are you sure you've been exposed?" And he said, "No, there's absolutely no way." And I said, "Look, just check yourself to be sure." When we got back the results, it was the highest results I've seen. And when he finally got to about halfway down detoxing the mold, phosphatidylcholine 3 grams twice a day, 500 of glut twice a day, Alamax alpha lipoic acid 600 twice a day. The binders we were using is GI detox with charcoal clay, little glucomannan, optifibrillin from Zymogen, Saccharomyces boulardii, the standard protocol. Once it got to half down, he said, "Oh my God, I finally feel the effects of everything we have done up until now." But until those toxins were all the way down, he really couldn't tell. So question now about the antibody versus this. If you, because Vibrant, and I have to check with them, I think now in New York, they just got some new approvals in New York. And I have to see because would you say in general, because one of my patients just asked this question, his mold test was getting better. He kept detoxing, it was getting better and better. And all of a sudden on this last test, it shot all the way back up. And then the
Mm.
question is, and he didn't get yet do itraconazole or anything to clear the sinuses or the gut. And we were wondering, what is from internal? What is he still like? As you said, he is the moldy building.
He is the moldy building, yes, yeah.
Versus what is outside, because they had a company come in. They really couldn't find a lot. I've already told people, yes, you can be exposed 10 years ago at your college dorm, and
Yeah.
it may not be from that. But do you find, like in heavy metals, when I used to detox them, most of the people, the detox goes well. It
Yeah.
keeps going down. Sometimes I'll see a little bit come up, but they come down. With metals, I used to see sometimes like mercury would come down and, arsen would come down, then lead would shoot up and then I'd
Yeah.
chelate more and lead. So when you're pulling these things, are you finding it in layers also where you're sometimes finding some of these coming out in layers and some shoot up because they're layered in the body? You can see that without necessarily exposure, or is it that there may still be spores that are existing in the sinuses and the gut, and that's why it needs to be cleared?
Yeah, both can be
Both.
true. It is a little different than the sedimentary layers of heavy metal toxicity. It was like you could get the easy ones off, and then it would be the more stubborn ones and the ones that needed a more like a dithiol instead of a monothiol could get it out of the body, and you needed a little different kind of way to get it out. With the mycotoxins, it's a little bit different because they are the smoke of a mold factory. And if that mold factory is still in the body somewhere, the smoke can go up again, even if you've detoxed it all out. So a lot of times that's a sign that if we've done a good job, like earlier you were saying, standard protocol, I do things a little bit differently because my patients, when I add Saccharomyces boulardii, they get the sweet cravings. That usually will flare for them neurological
Right.
problems. And so I'm like, yeah, and I found some research that shows that Saccharomyces can keep zearalenone in its reduced state, which makes it more toxic. So I just thought, I have lots of other ways to bind people. I'm just going to
By
drop.
the way, I learned that from Neil with the Saccharomyces,
Yeah,
but
yeah,
if all of my patients to stop C. diff diarrhea take Saccharomyces for a period of
yeah,
time, and we haven't seen a case of C. diff in
yeah.
ages. So you're not necessarily leaving the Saccharomyces on board when they're doing the mold because you're finding sweet craving. This is the first time I've actually heard this.
Sweet cravings and more neurological problems. Yeah.
Ah, interesting.
Yeah.
Okay.
And so I just was like, all the animal studies are beautiful. It works perfectly as a binder. It binds all the things it says. And the animals are fed a measured diet. You give a human Saccharomyces, and I learned this from my patients. I mean, I found the research just like everyone else can do that on PubMed. And I was like, oh, I use Saccharomyces all the time for antibiotic diarrhea. Great, or to prevent candida, or like you said, C. diff. Gave it to my patients, and my patients taught me. They're like, "Is it weird though that my neuropathy down my legs is worse?" And I was like, I'm not really sure. So of course in your head you're thinking, okay, what's going on with the infections? And it just happened over and over and over again that they started to become carb cravers, had more candida issues. And I was like, that's supposed to go the other way around. So I think when mold is in the environment, there's so much immune suppression that it allows, those of us that are free choice diet eaters, we're not fed a measured diet. We're going to go over to the sweets and the alcohol and things like that with Saccharomyces. So
Right.
I just don't use it because we have so many other options.
So
Um,
what do you, yeah, so
yeah.
what do you like as binders for pulling, how are you doing it at this point in time?
Yeah, in an inhalational exposure, the mycotoxins are getting in through the respiratory passages, through the skin. It's different than an ingested exposure. So before I do any urine mycotoxin testing, I have patients go on a 3-day low mycotoxin diet. So if anyone wants that handout, that's on my website in the footer. You can share it in the summit if you want to. There's a 48-hour washout period for most mycotoxins, which means if you ate it today, 2 days from now, 48 hours from now, you should have excreted that already, either through your liver and the bile or through the kidneys. And it turns out the kidneys are the primary route of excretion for most of these mycotoxins. So we can enhance kidney clearance and we're doubling our detox power and it takes the pressure off the liver.
And
But
what do they have to avoid specifically?
the high mycotoxin foods, and I changed that handout based on the latest research. So it's going to be things that we know are going to be contaminated with mycotoxins.
You're not
So
just talking peanuts and aflatoxins and stuff. You're talking, yeah.
yeah, corn, corn's really high in fumonisins. So some of those things that we know are going to be contaminated. And that's based on, food testing and things like that. So I'll update that every now and then by the latest testing. And kind of going back to what you were saying, oh, I just lost it. It was good. Oh, sometimes the mycotoxins don't come down because we're not addressing the way the body wants to excrete that. So like ochratoxin, zearalenone, citrinin, these are persister mycotoxins because they bind to the albumin in the blood and the kidneys can't clear it because it can't lose enough albumin. So the kidneys are in this decision point of like, I know there's a toxin on this albumin, but if I let go of too much albumin, now I don't have carrier proteins. I don't have osmotic balance in the blood. You get more POTS. A lot of times with POTS, I'll add taurine and it stabilizes that osmotic balance in the body. And what will help with denaturing the mycotoxins from the albumin is bioflavonoids, specific bioflavonoids, delphinidins, zearalenone, and zeaxanthin and astaxanthin. They help denature and then the kidneys can just get rid of it and now the albumin can stay. So the GFR can just take the albumin and put it back into the bloodstream. So that's one way that's a preferred way. If we think of an inhalation exposure, mycotoxins are coming in, they're lipid soluble, so they get direct access to our capillaries, direct access to the bloodstream. So they're really available in the bloodstream for the body to say, okay, this one we want to get rid of at the kidney level. If there's enough bioflavonoids in their bloodstream, it'll clear the kidneys. If there's
And
not,
which
go
and
ahead.
which bioflavonoids, again, just to be specific with it, which ones do you like specifically that you
Yeah, I use so full disclosure, I'm formulating for a company that specializes in mold detox. So of course I'm going to create my favorite bioflavonoid. So there's a product called Color Guard that is a mix of bioflavonoids. When we take the persister mycotoxins and we look at the research studies, which bioflavonoid helps with the albumin denaturing, that's a mix of those bioflavonoids that do that.
and from
Um,
diet? I mean, just can you get it from eating
Yep,
berries?
it's
I mean,
not going to be. I tried to do this because I'm a naturopath. I tried to do this diet only. I found that when they have a mycotoxin load, they really they need supplementation. You can do it through juicing.
mhm,
So anything in the orange color band. So if you're a juicer, carrot juice can help.
mhm,
Um, and if you like squash, you can eat a lot of squashes. You can do orange, yellow, orange, and red bell peppers. Those help.
mhm.
So you can do it through diet. I highly recommend people enhance their diet though with some supplementation early on, just to help with that detoxification, take the load off. The fatigue gets better, the cognitive function gets better, the eyes get better, all of that. Dark circles under the eyes, that's always a sign to me their kidneys are under stress. And I know I need to be supporting them with bioflavonoids and melatonin. Kidneys love melatonin. So yeah, there's just those little things that we can do. So you were asking what binder do I like?
Yeah.
First, I do bioflavonoids before binders because I want to double the detox power. I want to use the kidneys. And then the binder, if we think about it, it's in the bloodstream, goes to the liver, packages these mycotoxins into bile. We're really binding bile when we're
Mhm.
binding with mycotoxins, unless they're eating a lot of them. Then we want to do those specific mycotoxin binders. Or if they're constipated, the mycotoxin will come off the bile. And that's where using the specific ones like in Neil's research that's so important to know, charcoal for this one, that kind of thing.
Right.
But I really focus on doing bile binding, which is insoluble fiber. So
Hmm.
insoluble fiber is, they have lots of studies that aren't related to mold. People are missing their gallbladder, people have bile dump diarrhea. They find that insoluble fibers such as psyllium, it's one of the, oldie goldies. It's really, really reliable. Flax, chia, if they have SIBO, the SIBO safe ones, sunflower, sesame seed.
And by the way, every morning in my yogurt, teaspoon of flax, organic flax. And by the way, we only found the organic flax, believe it or not, northern, it's from Canada. We couldn't find a full organic flax here in the United. We thought
Thank
Spectrum
you
had
for
come.
saying that.
So
Yes.
we do a teaspoon of flax, a teaspoon of black seed, and a teaspoon of hemp every
Nice.
morning in the yogurt. So I'm making sure both for Akkermansia and all the good species in my
Yep.
gut, Bifidobacterium, etc. But now I'm finding out, and I didn't realize this, that you're also using it. I didn't realize it was having also an effect at the same time. I mean, of course, it
Yeah.
makes sense because I don't like a lot of cholestyramine. I mean, the gas and the bloating, and apart from replacing vitamins, fat soluble
Right.
vitamins,
Right.
I just found it difficult for people to take. And because the charcoal clay binds make most of these anyway, apart from using glucomannan, I just found it easier on people's guts. But I wanted to also ask you about humic fulvic acid because this is coming
Yeah.
across my screen lately and it binds a lot of things. Do you use it in the protocols and how do you use it if so?
So I learned from Dr. Stephen Harris a long time ago that it works really well for Lyme disease. It gives people like a cellular battery charge if they're really, really depleted people. Um, and I use a product from Mother Earth Labs. It's in a glass bottle, so there's no migration of plastic or anything like that. I found though, because I was so excited about it for Lyme, some of my mold sick patients would get more neurological problems from it. And I'd be like, what is going on? I don't really, again, you see the patterns and then you do the putting it together, finding out that it's basically fermented soil juice.
Mhm.
And fermented products in general are harder for people who are mold sick. They have more histamine. They just have more, potential for having mold be in the picture with the ferment. Like a lot of nutrients are fungal ferments, and we put them in the capsule. So I do use it, but I use it very cautiously, and I will send home a sample bottle so someone doesn't have to buy the whole big old bottle and see if they're one of those people that's a fermented product sensitive person, and then I don't use it. It has been shown to be good binders, but again, that is going to be loose mycotoxins that are loose from the bile. So I will use it for the people where I'm looking, kind of like how I used it with Lyme. You need a cellular upcharge, it's people who kind of need that like cell by cell, and you can just see it. There's the light is dim. And so the research is, it binds some things, but I see it really more as people who are really mineral deficient and need a cellular charge. And then I find it really,
And I mean, I've also asked, I normally you're supposed to be doing these a couple of hours away, like clay charcoal a couple hours away. You find also with humic fulvic, if they tolerate it, or
I
that
use it with food, just like with the insoluble fiber, I use it with food
you do
because we
you,
want,
and yeah.
mhm, yeah,
Because
we
I was
want
with
the
Dennis
like,
Schoen from Research Nutritionals just a couple of nights ago because they have a mycopole, right? A toxin pole, a mycopole. And I was asking him about it. And I was also asking the rep from Cellcore because
yeah,
they have one also. I was kind of curious because I'm not using a lot of it now. And I wanted to just check it out for some of these patients that, as I said, I'm having good results with the protocol I'm using,
yeah.
but I'm finding some stragglers where it's like, why did that just, and that's why I'm asking you these questions. So, but you can take the humic and fulvic with food. You're not finding it's binding the things at the same point.
If anything, well, the way I'm thinking of it is I'm using it as a mineral supplement.
Hmm.
So, the fact that it's a binder is sort of like, oh yeah, because it's a chelate. So I'm finding it more beneficial actually for heavy metal toxicity than for mycotoxins.
Okay.
Yeah. So, I just give it with food. We need that stomach acid to kind of further chelate the chelate.
Hmm.
And it's really helping people with the trace mineral deficiencies. Like I said, the people who just need a cellular battery charge.
Got
Yeah.
it. So,
I don't think of it in my head as a binder.
got it. Okay. Yeah. I mean, I was just kind of curious because all of a sudden it's coming across. I
Yeah.
already take like literally 75 supplements a day. It's like if you walked into my kitchen, I sometimes do this, by the way. So we have 1860s medical barn I just opened on my property. So I'm, it's like a 1,700 square foot. We play ping pong. In fact, just yesterday, I walked in there and the kids are playing ping pong while I'm waiting for a physical examination. I'm probably the only doctor. I've got ping pong going on before we do the physical examinations. In any case, so I sometimes take people down to my house. It's like 500 feet away. And I go, I tell you to take these supplements, but take a look at my kitchen. I just want to show you what I'm swallowing every day. And it's like, because I was wondering for myself, I realized that I had eaten a bit of dark chocolate for a while. And I'm then wondering how much lead and cadmium did I actually get in my body? I need a heavy metal detox. And I'm thinking, oh, I don't want to do DMSA again because I got a little itchy on it last time. Let me try the humic and fulvic. So I've, been taking it to see, and it seems like by the way, I am a little histamine sensitive. I can't do like corned beef sandwiches with sauerkraut. And my wife can't do, fermented foods like bone broth and stuff. We
Mhm.
both, but for some reason I'm tolerating the humic and fulvic without a
Yeah.
problem.
Yeah, where I see the people have more problem is if they have a gray water spill. So a clean water spill, if you want to think of it that way, like rainwater coming through the roof, that doesn't have a lot of bacteria in it. Whereas like a sewer backup, you're going to get a lot more bacteria in the moldy building, which we haven't even talked about endotoxins and actomycetes. But if they have more of a bacterial load from a gray water spill, they tend to have more sensitivity to the humic fulvic. Whereas if it's just mold, and that's because humic fulvic isn't fungal ferment, it's bacterial ferment. So they can usually handle it.
Okay. So if I'm taking this with minerals and stuff, if people are taking it with multi-minerals and stuff, it's fine because you're saying it's part of the fiber that's kind of getting in there at the same time.
Yeah.
Good.
So basically it's a chelated mineral supplement.
Got it. So one last question. By the way, you and I could be doing this easily
I
for
know,
hours.
I know.
Oh, no. I can see this. I can see this could go on for hours. We're almost going on an hour, Jill. And it's like, I don't even know where it went.
Yeah, I don't either.
So
Yeah, we have lots to talk about.
we did. One last quick question though, and then we're going to wrap up a little bit.
Good.
ERMI testing, when people do the home testing, role of ERMI testing for people as opposed to just having a mold remediation company come in there because there's all kinds of different tests they do with dust and mold sampling in the air. Can you just discuss just briefly and then we'll kind of wrap this up and we'll give people an overview.
Yeah. So ERMI testing is good for speciation. It's not good for giving you an idea. If you use the ERMI score, the algorithm that's used is very problematic for diagnostics. The ERMI was developed as a survey instrument and not as a diagnostic tool. So we're using the wrong tool. So what we should have, and what a lot of really good inspectors have, is sort of an ERMI per species amount that is alarming to them. So they have kind of like an interpretation matrix. Jason Kester of Kester Clear, he's in the Pacific Northwest. He has one of the best interpretation matrices that's out there. And it's basically, if you see Stachybotrys and the count is above 5, that's a problematic situation, no matter what the ERMI score is. So I just say to people, throw out the score and have your inspector look at the species and the level, the total count of that going on in your home. I also combine it with a home mycotoxin dust test because you can have the spores completely sealed off behind building material, or if it's in the attic, but the mycotoxins are able to migrate into the indoor environment. And it's the mycotoxins that are creating, for my patient base, 70 to 80% of the symptoms of mold illness is because of the mycotoxins. The spores are causing more allergies, mast cell, that kind of thing. So I want to know what the mycotoxin load is too, because that's a big player in the symptomology. So there's a company called Hayes Microbial Lab. You can get it from your inspector. I have the kit on my website that will do a mycotoxin dust test using a sterile swab. That's the other problem I have with the ERMI. Make sure you're using a sterile measuring tool. If they say, go get a Swiffer and test, how do you know the Swiffer wasn't dusty, or moldy, or was
Right.
stored in a moldy warehouse? So anyone doing an ERMI should be sending you a sterile measuring tool. So a sterile swab or a sterile whatever. And with this mycotoxin dust test, they test over 25 mycotoxins that are often missed. Chetoglobicin, which is often missed in all of the testing, and that one goes through the blood-brain barrier. It's connected to dementia. It's a really important one for us to know about. So through Hayes Microbial, which is Hayes, any doctors that are listening, you can get an account with them and get kits and send those with your patients as well.
Got it.
And it's, really, really affordable. It's comparatively, you're getting 25 plus mycotoxins for about $300.
Yeah. Okay.
And it's a
Uh,
wonderful assessment.
Great.
Yeah.
And last question I have, the amount and the importance of itraconazole
Ah,
for people who have mold in their sinuses, mold in their gut. Tell me what you've seen with people who've been detoxing the mold. They take itraconazole. What has been your experience with it? How much does it actually help? Again, if they are the moldy building, we're going to assume it's going to make, but I want to hear from you your experience and what's the dose you've been using and the length of time averaging. Because, we learn in med school, be careful with this because the liver functions, that 1 in a million person who the liver goes off. And so I'm always careful using it and the length of time. But I've been speaking to doctors who've used it for months. So I want to hear from you the length of time you used it, the dosing, and what you've seen in patients.
yeah, especially as a naturopath, right? Because
Right.
we're what, anti-medication?
Well,
Yeah,
not the ones I know
not
that
the
are.
ones yeah.
Yeah.
Yeah, so I think the liver enzyme issue is people who were in mold and they took itraconazole and they weren't prepped. Because that's the other thing about using antifungals. You need to prep the body for the fact that what we know from Petri dish studies is mold will make more mycotoxins to defend itself when you start attacking it. So if you haven't cleared out the body burden of mycotoxins first, which is all the stuff you're talking about, liver detoxification, what I'm talking about, bioflavonoids for kidney clearance, prep the body, get it ready for the fact that there's going to be an onslaught of mycotoxins the minute you start an antifungal. That's when I really pump the charcoal. And yes, I do use itraconazole. I usually start with plants for most patients, not, people who are really oxalate sensitive, histamine sensitive. We might need to use the pharmaceuticals first to get the levels down and then transition them to herbal. But itraconazole, it's rare if I decide it's time to use it that I use it less than 30 days. A typical is 60. We'll test liver enzymes on day 45. I see sometimes it will rise, but not into dangerous levels because I've prepped my patients.
Right.
Their livers are ready for the onslaught of the
And
mycotoxins.
200 milligrams, you've had to go higher.
I started 100 and see, because the ultra sensitive, you start with 200 and it knocks them out. And the way the triazoles are metabolized, we lose a lot to what's called first pass metabolism for people who are listening. We docs know this, first pass of the liver, you're going to lose a ton. So 100 milligrams twice a day means you're going to lose more drug if you do 200 at one time. So
Mhm.
200, if you're going to go up, then you want to be using 200 at one time. If their gut can tolerate it, because then you're
Yeah.
getting more medicine.
Yeah, I haven't. I mean, 200 at once is kind of what I've been. Most people have seemed to be able to tolerate it fine, but I'm giving them a lot of liver detox
Yeah.
supplements. I mean, including even from Zymogen, they make a Medcaps DPO with dual phase optimizers with diindolylmethane and sulforaphane
Yep.
glucosinol. I mean, so they've got so much
Yep.
in there to get the liver prepped for it.
Right.
Even Dr. Zong makes a heparin number 2 that we
Yep.
found liver protection. We've even used that sometimes to protect people when we need it. Have you ever had to go to 400 milligrams? You found that 200 is usually average dose and enough for most people?
200, and then I'll add herbs for resistance.
Okay.
So if 200 isn't doing it, we've got some resistant species, and there have been plenty of studies using triazoles with herbs, a couple of herbs, thyme, oregano, pau d'arco, garlic. The garlic is like across the board the easiest one because pregnant patients can take it. They can take it if they're nursing. Pau d'arco, they cannot. So yeah, those are plants that I'll add then to make sure that we're dealing with the resistance.
Got
Yeah.
it. And a
And
lot of my
usually I'm starting with them.
Yeah, and a
Yeah.
lot of my patients are on cinnamon, clove, oregano oil as biofilm agents. So
Yeah.
they're already doing most of these too.
Yeah.
Yeah, to begin with.
Clove. Yeah, I should have mentioned clove isn't in any studies, but I use it for resistance.
Yeah.
That's the thing is a lot of people think, oh, I took this Candida formula, so I'm taking care of the mold. No, yeast is a single cell molecule or single cell organism. The spores are multicellular. So if it's good for yeast, it's not necessarily going to knock out the mold. You need things that are stronger. Yeah.
Well, I have to tell you, this was one of the best interviews I have done. And it's not to say anything against any other This was fabulous. It was so fabulous speaking
It's
to you.
such a
People are
treat.
going to get a boatload of information from this particular talk. So again, it's moldiq.org is where they can get the questionnaires, the information on bioflavonoids. All of that is on that website.
No, the bioflavonoids, that'll be on my Dr. Krista website. That's drkrista.com, drkrista.com. You can get my low mycotoxin urine mycotoxin prep sheet, my handouts. I have a ton of video blogs and information. I have specific mycotoxin protocols. If you go to drkrista.com/aflatoxin, you'll get a symptom list, a protocol that's specific to that mycotoxin and how we detoxify it.
Right. And if they want to read some of your great books,
Oh yeah, yeah. We've
maybe we
got
should show them some of the books.
break the mold. And then because mold is behind pandas and pans so often, a light in the dark for pandas and pans. I'm a mama of kids with pans. So I've got in the trenches experience on that one. Yeah.
Got it.
Yes. It was a real treat to chat with you.
Yeah, for me also. So I just want to thank you so much for taking the time today. People really, they're going to get a huge amount out of this talk. Listen, blessings to you for everything you're doing. You're filling in a gap, by the way, for all of us. You know, we all have our niches and specialties, but the great part is that we're learning from one another along the way, and we're all in the same field of chronic disease medicine, right? So I mean, what you do is important for what I do. What I'm doing with Lyme and Bart is important for you and Neil. So yeah, it's just great. So keep up the great work. And again, you've been listening to Dr. Jill Krista. We've been discussing mold toxicity and overlaps with chronic Lyme and chronic fatigue illnesses. This again is Dr. Richard Horowitz, your co-host for the Dr. Talks Healing Lyme Summit 2.0. Thank you so much for joining us today. We'll be seeing you again soon.